the essential guide to pet grooming and hygiene. For many pet owners, grooming is synonymous with an occasional bath or a trip to the professional groomer for a stylish haircut. But true grooming is far more fundamental. It's a cornerstone of preventive health care and a profound act of care that strengthens your bond. A regular, thoughtful grooming routine is your first line of defense against hidden health issues and a key contributor to your pet's comfort and longevity. The foundation: brushing, nails, and ears. A consistent at-home routine prevents problems before they start and familiarizes your pet with being handled. The brush-off. Regular brushing is non-negotiable for all pets. Dogs. Frequency and tool depend on coat type. A slicker brush for double-coated breeds, like Huskies, a pin brush for silky coats, like Yorkies, and a de-shedding tool during seasonal blows are essential. Brushing distributes natural oils, prevents painful mats, which can hide parasites and cause skin infections, and massively reduces loose hair in your home. Cats. For most cats, a weekly brushing with a fine-toothed comb or soft bristle brush is ideal. It mimics the grooming they'd receive from a feline companion, reduces shedding and hairballs, and is a wonderful bonding activity. Long-haired cats, like Persians, require daily attention to prevent severe matting. The clip. Nail trimming. Overgrown nails are more than unsightly. They can cause pain, alter posture, and even lead to arthritis or injured toe joints. The goal: trim just before the pink, blood-filled vein inside light-colored nails. For dark nails, make small, conservative cuts and look for a white, chalky center. The method: use sharp, scissor, or guillotine-style clippers designed for pets. Start slow, pair with treats, and focus on making the experience positive. If you're uncomfortable, a groomer or vet tech can demonstrate or handle it for you. The listen: ear cleaning. Ears should be clean, pale pink, and odor-free. Weekly checks are crucial. Cleaning, not probing. Use a vet-recommended ear cleaner and a cotton ball or gauze. Never use cotton swabs deep in the canal. Gently wipe the visible part of the inner ear flap. Red flags: a foul smell, dark debris, redness, or excessive head-shaking signals an infection and requires a vet visit. The silent threat: dental hygiene. Periodontal disease is one of the most common and preventable health issues in pets, with bacteria from the mouth affecting the heart, liver, and kidneys. The gold standard: brushing. Daily brushing with a pet-specific toothpaste, never human toothpaste, which contains toxic xylitol, is ideal. Finger brushes or small pet toothbrushes work best. Start gradually, letting your pet lick the tasty paste before introducing the brush. Supporting players. Dental treats and diets. Look for products with the Veterinary Oral Health Council (VOHC) seal, which verifies they meet standards for reducing plaque and tartar. Water additives. These enzymatic solutions can help reduce bacteria in the mouth, but are best used as a supplement to, not a replacement for, brushing. Professional cleanings. Annual or biannual veterinary dental cleanings under anesthesia are essential for a full assessment and cleaning below the gum line, where disease begins. Bath time basics, frequency, and formulation. The how often question depends entirely on your pet's lifestyle and skin. Frequency. Overbathing can strip essential oils, leading to dry, itchy skin. Most dogs only need a bath every 4 to 6 weeks, unless they've rolled in something unpleasant. Cats, with their fastidious self-cleaning, rarely need full baths unless prescribed for a medical condition. Product safety. Always use a shampoo formulated specifically for dogs or cats. Their skin has a different pH balance than human skin. For pets with sensitive skin, choose hypoallergenic, oatmeal-based, or veterinary-recommended formulas that are free of dyes and strong fragrances. Always rinse thoroughly. Feline-specific focus. Shedding and hairballs. Hairballs are a natural but manageable byproduct of a cat's grooming habits. The cause: cats swallow loose hair while self-cleaning, which can form a trichobees or hairball in the digestive tract. Prevention is key. Increase brushing. This is the single most effective tactic. More hair in the brush means less in the stomach. Dietary aid. High-fiber diets, hairball control treats, or a small amount of veterinarian-approved malt paste can help hair pass through the digestive system. Hydration. Ensure your cat drinks plenty of water. A fountain can help to keep their GI tract moving smoothly. When to worry. Occasional hairballs once a month or less are normal. Frequent vomiting, gagging without producing a hairball, constipation, or lethargy require immediate veterinary attention, as a blockage may have occurred. Knowing when to call the pros. Professional grooming. While home care is vital, professional groomers are invaluable partners for many breeds and situations. Coat-specific expertise. Breeds with continuously growing hair, poodles, Shih Tzus, Maltese, require precise clipping and scissoring every 4 to 6 weeks. Double-coated breeds benefit from professional de-shedding treatments during heavy shed seasons. Specialized services. Groomers are skilled in safe techniques for difficult tasks like expressing anal glands, giving medicated baths, or handling anxious pets. A health checkpoint. A professional groomer often spots early warning signs, like new lumps, skin irritations, or ear issues that you might miss, prompting a timely vet visit. The grooming bond. Ultimately, grooming is an extension of your care. The quiet time spent brushing, the patience during a nail trim, the vigilance over dental health, these acts communicate safety and stewardship. A well-groomed pet is not merely a clean pet, but a healthier, more comfortable, and more closely bonded companion. By integrating these practices into your routine, you're not just maintaining their coat, you're actively safeguarding their well-being for years to come.